Good afternoon, students. So since we are done in our lesson 1, let's proceed to our next lesson, which is common sports injuries. So sports injuries typically fall into two categories, acute and chronic or overuse. So let's have first the acute injury. So an acute injury is the result of an incident or accident that results in noticeable symptoms. For example, when you slip, fall, tackle, or collide can result in an acute injury. While some accidents are just a part of playing sports, others may be avoided by having proper gear and equipment and playing in safe conditions. Acute injuries have signs and symptoms such as sudden severe pain, swelling, and inability to move a joint through its range of motion that manifest immediately after force application. First, we have the sprain. It is an overstretched ligament, so it can be classified as mild, moderate, or severe depending on the loss of function and the number of torn fibers. A commonly sprained ligament is what we call the anterior cruciate ligament or ACL. The ligament is a connective tissue that helps stabilize the knee every time the muscle contracts. The injury occurs when the knee or ankle twists while weight is placed on it. So as what you can see in the video clip, Stephen Curry got an ankle sprain when he made a fast break move. Next, we have the strain. It is also caused by excessive stretching that causes tears in the muscle tendon unit. It is a twist, pull, or tear of muscle or tendon. The most common strains are located at the lower limbs such as the hamstring and the calf muscle. So the calf muscle is made up of two main muscles, the gastrocnemius and the soleus. So the gastrocnemius is the larger thigh muscle forming the bulge visible beneath the skin. It has two heads which together produce its diamond shape, while the soleus is in a lower or it is a flat muscle that lies underneath the gastrocnemius muscle. And here is an example of strain in which the football player got when he was trying to get the ball from the opponent. Next, fractures are breaks in the continuity of the bone. It usually occurs as a result of high impact forces that cause the bone to bend or twist. It is normally treated with immobilization by attaching a fixator or a cast. Here is an example of wrist fracture, which has an external fixator. Fractures are common in sport, particularly in contact sports such as football and rugby. The most common injuries include fractured wrists, hands, collarbones, and bones in the ankle and feet. Next, dislocation is when the bones are pushed out from the joint capsule. When the bone is pushed out from the proper alignment, the injury will cause a deformity and constant pain. Dislocations can occur in contact sports also, such as in football and hockey, and in sports in which falls are common, such as downhill skiing, gymnastics, and volleyball. Also, basketball players and football players also commonly dislocate joints in their fingers and hands by accidentally striking the ball to the ground or to another player. And lastly, concussion. It is a traumatic brain injury that affects your brain function. Effects are usually temporary but can include headaches and problems with concentration, memory, balance, and coordination. Concussion in sports is a type of mild traumatic brain injury that affects the brain when external forces cause it to move rapidly. It can happen in any sport, but some sports have higher risks than others such as football, hockey, and rugby. Concussion is considered as a life-threatening injuries because they disrupt the normal function of our brain. Next, we have the chronic injury, which is a longer term. It may begin as an acute injury that does not heal completely or may be caused by overuse or improper form. Many athletes play through pain when performing an activity, a dull ache when at rest, and swelling which can lead to chronic injuries. Overuse or chronic injuries are common among individuals who have been training for a long period of time with minimal rest and recovery between sessions, particularly common in endurance sports such as swimming, running, and cycling. And here are some of the examples. First, we have the stress fracture. It is a small crack in a bone or severe bruising within a bone. Most stress fracture is caused by repetitive activity. Stress fractures are very common in sports which involve repetitive movements. For example, long distance runners often suffer from stress fractures in the foot. Next, tendinopathy or tendinitis. It is the most common overuse injury in sports. It is the inflammation of a tendon. Tendinitis occurs in any of tendons, whether in shoulders, elbows, wrists, knees, and heels. The pain from tendinopathy can interfere with your daily life. For example, it can keep you from playing sports and from doing housework. So if you have pain or swelling, make sure to contact your healthcare provider for help. Next, osteoarthritis is a wear and tear of a joint that results to its deterioration. It occurs when the cartilage or cushion between the joints breaks down, leading to pain, stiffness, and swelling. Osteoarthritis is one of the most common types of arthritis that affects millions all over the world. For most people who exercise or play a sport regularly, there is no concern regarding their risk of developing osteoarthritis. However, certain sports can increase your chances of a joint injury, which sometimes leads to the condition. Next, bursitis is the inflammation or irritation of the bursa. The bursa is a sac filled with lubricating fluid between tissues such as bone, tendons, and skin that decreases rubbing, friction, and irritation. A subcutaneous olecranon bursitis in sports is most commonly causing immediately swelling and deformity at the elbow because the olecranon bursa is the largest bursa in the elbow. When this bursa is injured, the function of the elbow can be significantly affected. Next, shin splints, also known as medial tibial stress syndrome or MTSS, have a number of causes and may occur on the outside or the inside of the shin. With anterolateral shin splints, pain around the front of the shin starts immediately when your heel strikes the ground awkwardly. In posteromedial shin splints, the pain is felt on the inner part of the shins and is worse when you stand on your toes. If you keep running on a regular basis, when you have a shin splint, the pain tends to spread towards the knee. Shin splints are pain in the front of the lower legs or inner due to heavy physical activity or certain sports such as tennis, racquetball, soccer, or basketball. Next, Achilles tendinitis is when the tough sinew that attaches the calf muscle to the back of the heel bone is most likely to be damaged if you participate in running or jumping sports. The injured Achilles tendon feels tender when squeezed between the fingers. Pain is usually at its worst in the morning and improves with walking. Vigorous exercise will increase the pain for a bit and then improve it. Achilles tendinitis most commonly occurs in runners who have suddenly increased the intensity or duration of their runs. It's also common in middle-aged people who play sports such as tennis or basketball. Next, lumbar strain is when the standard weightlifter's injury can also occur in sports that involve sudden twisting of the back, such as golf and baseball. Sudden lower back pain appears with twisting or lifting. It may seem fairly minor for an hour or two, but carrying on the exercise will usually bring a sudden deterioration with extreme pain and back spasms. Next, lateral and medial epicondylitis, more commonly known as backhand and forehand tennis elbow. Backhand tennis elbow can also occur with overuse of a screwdriver, but tennis may be more problematic because not only you are gripping hard, but there are also repetitive shocks being transmitted to the flexed wrist tendons. Forehand tennis elbow is also common in golfers, baseball players, and people who have to lug heavy suitcases around. You feel pain when you flex the wrist backward, lateral tendons, or forward or medial tendons. And lastly, the metatarsal stress fracture. The second to fourth toes are vulnerable to breakage if you push off with your toes when sprinting or running long distances. For example, Army cadets doing running and marching drills are likely to suffer stress fractures during training camps. Dancers and gymnasts experience stress fractures because of frequent jumping. The front of the foot starts hurting during exercise, and the pain usually stops when you finish. With each subsequent bout of exercise, the pain appears earlier and gets steadily worse. The fracture can take up to 3 months to fully heal. For your activity, instead of groupings, we will have an individual output. I want you to create an acrostic poem. You will choose any injury and the content of your poem should be about your chosen word or topic. Here is an example of an acrostic poem. And for your rubric that will serve as your basis, content 50%, creativity 30%, neatness 20% in a total of 100%. So, you will pass it on our next meeting. So that's all for today. Thank you and goodbye.